yes, we shall overcome all the hurdles that come in our way, especially HIV. Today, we are very privileged to have Dr. Sharda Jain, who is going to speak. Ma'am is going to speak on update on contraception in HIV couple. Over to Dr. Sharda Jain, ma'am.
Hear me?
Yes, now we can hear you, ma'am.
Okay, that's it.
We can.
Today I'm going to update on contraception on HIV. When on a very simple topic where there is nothing, somebody senior speaks, it means every word matters. My life motto is remain student till end. If you stop learning, you become old, whether you are at 20 or you are at 80. If you keep learning, you want to stay young, then you should keep learning. I'm not going to bother yourself. This is the areas which each one of you who has been participating on these workshops should be able to answer simple things. My question to all of you is, no answers are required. Why HIV is called retrovirus? If you don't have an answer, you should have an answer. I'm not going to ask you. What are HIV-related gynecological diseases? And this is what its initial manifestations are. As far as last 2011 census are concerned, the people living with HIV positive cases in this country were 2.1 million. Earlier we were told that in this country there's a north and the south divide of 1:2. Southern India, the incidence around 2% and northern India is 1%. But I think, because of the actions, focus-oriented actions, national adult HIV positive cases are only 0.27%. This is because of the great work done by NACO. The women who are positive are 40%, and the children less than 15 who are positive are 7%. I don't have to tell this August gathering how the transmission of HIV is there. What we are bothered about as a gynecologist, that substantial number get HIV by vertical transmission during pregnancy, during labor, and during breastfeeding. And if we do not offer any medical intervention, this transmission is to the tune of 30 to 50%. But if we do a medical intervention, give them ART, this can be brought down significantly. As far as the WHO guidelines are concerned, again, marked repetition, but that repetition is required for each and everybody. Once diagnosed, it is lifelong ART. To all pregnant patients, to all patients who are breastfeeding, living with positive HIV, regardless of CD4 count or clinical stage. I repeat again, एक बार आपने दवाई शुरू कर दी तो आपको लेनी ही है. And it holds definitely true during pregnancy and breastfeeding time. According to the WHO, each government's job is to provide ART free. During pregnancy, to breastfeeding mothers with HIV positive. And the idea is that this transmission is brought down significantly. What is the four-pronged strategy of NACO? हिंदी में अगर कहूंगी तो उसका प्राइमरी एम है कि women of childbearing age should not get HIV. So the primary prevention of women of childbearing age, that they are safeguarded from the HIV. The second strategy is, अगर हो गया अभी आपको HIV, तो आपको unwanted pregnancy नहीं होनी चाहिए. और अगर unwanted pregnancy हो भी गई, तो आपको you should prevent HIV transmission from the mother to the child. And in the end, provide total care, support, and the treatment to women living with HIV, her children, her family, in a woman of childbearing age. Counseling and testing of HIV of anybody, that even includes pregnant women, is a separate talk by itself. किसी को आप वो कर HIV नहीं कराना चाहता तो आप force नहीं कर सकते उसको. Every time they visit to the clinic, you can only request with a folded hand. It is good for you. It is good for the community. It's a separate talk by itself. Now, being associated for a good 5 years with NACO, I can definitely say that with energetic bureaucrats, medical fraternity, with ART treatment, being increasingly available for Indian people, HIV-infected pregnant women and men are now living longer, healthier lives, healthier to the extent that they desire to have children and have children. When they make reproductive plans, preconception counseling is very important. And in that particular time, it is talked in detail. What is your HIV status? How good control you have? Can you have family? And what are the instructions associated with it? Preconception counseling of HIV positive people is almost similar to that given to the non-HIV infected pregnant patients. Infected woman who is aspiring to become pregnant. Aim is to improve the woman's health before conception. Identify special risk factors which may affect fetal-maternal outcome. At the same time, whether before pregnancy and during pregnancy, the safe sexual practices have to be adopted. Before that, we have to see that do the testing and the treatment of STI in case of the additional present. Couple sexual history, the condom usage, the duration of relationship with current partner, their HIV status of the partner, sexual decisions, making or control of reproductive choices are important. Then the reproductive desires of the couple and the discussion options are taken. They have to be told that they have to avoid smoking and substance abuse, which is pretty common in such cases. And the folic acid as for any other person who is aspiring to become pregnant. So in family planning counseling, which includes planning the family, and in case of not, using contraception. Counseling is very important for planning and the birth with effective contraceptive method. And we must not forget, it's always dual contraception. Dual protection is the key. The couple should also know the effects of progressive HIV disease, and it has no treatment at the moment. You can only control. HIV transmission should be mindful key awareness, which should be there with everybody. The person who is HIV positive and the partner. The risk of transmissions to an unaffected partner to be avoided while trying to conceive with unprotected intercourse. There are guidelines for that. Then the counseling has to be there for the vertical transmission. They must know fully well that the medications are required throughout pregnancy and during breastfeeding time in case if at all they're doing it. Information of the effect of HIV on pregnancy and the possible increased adverse pregnancy outcome also the couple should know. Dual protections with consistent condom use is the key. What we mean by dual protection, and I will also touch on emergency contraception in the end. There are two issues whenever there is a sexual activity. In a person who is HIV positive, that the condom usage is required not to increase the viral load. Secondly, to prevent further any other STIs. And a very effective method is required for prevention of pregnancy. The condoms are not good at it. Now, in this particular group, I have sent one slide. And this is a reminder to every gynecologist, however big they are. There is one thing called perfect use of contraception. That is something different. The typical use of efficacy is something different. Let's take an example of oral contraceptive pill. The oral contraceptive pill with a perfect use, the failure rate should be only 0.3%. But the typical use we find, the failure rate is around 8%. As far as the hormonal implants are concerned, once it is inserted, it is effective till the time it is taken out. So the perfect use is, the failure rate is 0.05 and the typical use is also 0.05. As far as the vaginal rings are concerned, or the skin patches of combined contraception, those patches are perfect use 0.3% and the typical use 8% is the failure rate. As far as medroxyprogesterone DMPA injection is concerned, it is perfect use is 0.3% and typical use is 3%. 10 times. The condom, the perfect use gives a failure rate of 3%, while typical use has a failure rate of 15%. And I will say in Indian men, it is even more than 15%. Dr. Ruby is going to talk about the barrier contraceptive. Probably she will touch about the cervical caps also. The typical thing which you all must know about it, that's why we are not using it. Cervical cap with spermicide is 18% is the failure rate if you have got children. And if you are nulliparous, the failure rate is 9%. And in typical use, this is much, much more. IUCD, the failure rate is 0.1 to 0.8%. And the typical use is also the same because, there is no human effort. Once it is inserted, it is going to be effective till the time it is taken out. Natural family planning method, which is rhythm method, the failure rate is to the tune of up to 10%, but in typical use, it is about 25%. And I must mention, significant number of patients use, I will say significant. Kya contraceptive use karte ho? Madam, withdrawal method. So the all gynecologists must know that perfect use failure rate is 4%, but the typical use has a failure rate of 27%. 27%. Now here I wish also to tell you is, again I have sent a slide on this particular group. What is the risk of HIV transmission during sexual activities? None. If there is a dry kissing, body-to-body rubbing or massage, bathing or showering together, theoretical or extremely low, is in wet kissing oral sex done to a male, you can read all about this. The law is there because these days the oral sex is very much in fashion. Beside vaginal and anal intercourse. So you exactly should know what is the risk involved. The highest risk is there with vaginal or anal intercourse with or without ejaculation if the condom is not used or is used incorrectly. My request to everyone is the slide which I've sent, please should be read and remembered by everybody. So when we talk about dual protection, the dual protection refers to usage of condom, which I've just now told. Another effective method is oral contraceptive pill, and that can protect pregnancy to a great extent in case if it is used properly. And the condom is there for protection of STI as well as furthering the HIV load. As far as the condoms are concerned and its relation to pregnancy is concerned, is not an effective choice. It is only for STIs. Dr. Ruby is going to talk in detail about these two, the female and the male condoms. I can only say that a female condom, because the cost is too much for HIV prevention, and that is why its limited use is there. And that is why this August gathering of gynecologists, not a single one can tell you how to use it correctly. Contraceptives don't increase HIV risk, but they do interact with some antiretrovirals. I will touch in detail about this. Hormone contraceptive, I just now said, it is safe, it is effective in a woman living with HIV. This may be either oral contraceptive or a depot preparation of DMPA. DMPA is safe to use in women living with HIV as well as those on ART drugs. The present contraceptive is a hormonal contraceptive which is available. There is no hormone drug interaction with several ARV drugs commonly used in government program. As far as the IUCD is concerned, Ministry of Health and Family Welfare recommends copper T380A as an effective contraceptive for HIV-infected pregnant women after delivery. It's long-term reversible method for 10 years. It can be inserted in postpartum period as well within 48 hours of birth. It goes without saying, postpartum IUCD insertion requires special skill. Ordinary gynecologists cannot do that. As far as lactational amenorrhea method is concerned, it does not protect against STIs, it does not protect against HIV, it does not protect against pregnancy. Correct and consistent condom use should be adopted at every sexual encounter by HIV patient. As for the male sterilization is concerned, males should be motivated at every mother-baby pair follow-up whenever they're coming. Once you have completed your family, the male should be motivated to undergo vasectomy. Once the youngest child attains 18 months or 2 years of age, irrespective of the baby's HIV status, whether positive or negative. The rule after even vasectomy operation for male should be that they have to continue to use condom at every sexual encounter. As for the emergency contraception is concerned, if she had unprotected intercourse where circumstances suggest HIV or any other STI transmission, offer and start post-exposure prophylaxis for HIV immediately within 72 hours, just like emergency contraception. Emergency contraception 72 hours के अंदर लेना ही है, तो आपने post exposure prophylaxis भी 72 hours पे start कर देनी है. At the same time, treat for presumptive STI treatment if available or refer for further counseling, support, and treatment if you do not know. So the NACO recommendations for the mother and newborn in 2014 is that lifelong treatment will be given irrespective of the CD4 count or WHO clinical staging of HIV for pregnant women who are HIV positive. Newborn aspect will be covered by Dr. Rajeshwari in detail. Babies are given syrup for 6 weeks, started immediately after birth. And this becomes 12 weeks if the RT duration of the mother is less than 24 weeks. I'm subject to correction by Dr. Rajeshwari. So in conclusion, HIV positive person has to be always mindful of transmission. They require family planning counseling, both for family and later on to prevent pregnancy. They require preconception counseling. Goes without saying, during pregnancy, good antenatal, intranatal, and postnatal management. HIV positive pregnant woman with treatment will help in virtual elimination of parental transmission of HIV from the mother to the child. Goes without saying that the condom usage has to be done at all times. That is the safe sex practice. With condom usage and antiviral therapy, it's possible to have zero transmission. So, antiviral therapy plus safe sex during pregnancy, plus safe delivery, safe infant feeding practices, it is possible to have zero transmission. We'll have in detail by Dr. Rajeshwari. Thank you very much. This particular group holds meeting on HIV-related topics on the 10th of every month at 4 p.m.
Thank you, ma'am, for this enlightening talk. When a great speaker like Madam speaks, not only is it informative, her talk, but it teaches us how to be humble, how to be passionate about our subject, and how to be an eternal leader and an internal learner. And now, without wasting much time, I would request